All right, so we're going to go ahead and get started with the next session, which is working with speech language pathologists, a workshop for interpreters in educational settings. And we're going to have our presenters in this occasion, um, which is Angela Sasso and Layli Nignafs. I hope I pronounced that correctly.
Yes, that was
Um,
good.
Angela is a leading expert in public sector community interpreting with over 30 years of experience in public policy, program design, and interpreter education. She holds an MA in Intercultural and International Communications and is the founder of the Interpreters Lab, advocating for professional trainings in equitable, effective communication in healthcare settings. And Layli is a certified interpreter, STIBC board member, and instructor at the Interpreters Lab. She holds an MA in Translation Studies and a degree in Speech Science from SFU. Her background in speech language pathology, including volunteering as an SOP assistant, informs her work in medical and community interpreting. So everybody, thank you for being here. And without further ado, the floor is yours, ladies.
Thank you very much, Alex. Before we start, I just have to say I got hit by a cold a few days ago, so my voice is like this and I might start coughing. So my apologies. I want to thank the association for inviting us to present today, and we're tag teaming it. Layli is the content expert in these matters around speech language therapists. So today we hope to provide you with some tools and some best practices that you can use, but really what we're providing is also, or offering, is a platform for discussion, so that we want to hear what your experiences are as well and how we can help you better define your practice and give you, as I said, those skills and tools. So Alex, can you start the poll? So my understanding is you've already had an initial session with a speech language therapist, so I wasn't sure if everybody who did that session is also back here. So we've just done this quick poll. If you can let us know where you're at with these questions.
Okay, we're gonna end the poll.
Okay, great. 75% have worked with SLPs, mainly with children, equivalencies, cultural differences. You see that, Layli? Understanding the process. Okay. Great. So just a couple of weeks ago, I actually did a presentation to our speech hearing association here in BC. So a group of speech language therapists and audiologists. And it was very interesting because I did a survey prior to that to get an understanding of where things are at. How the two sides are not really speaking to each other, the interpreters and the practitioners. And it's the collaboration that we need to find a way of building, because speech language therapy is a very and audiology is a very challenging place for interpreters, as is any complex care.
Yep.
So today we hope to really provide a foundation for discussion, and hopefully these things will continue. And I know with interpreters in educational settings, these sorts of assessments are very important in addition to others, right? But that they happen in educational settings. So we're just going to be reviewing some of the work of speech language therapists, pathologists, the role of interpreters in those settings, exploring their challenges and concerns, and identifying some strategies, how to avoid errors, what not to do, and how do we enhance collaboration, closing off with some best practices, and then going to some questions from you. Okay, so Layli, I will let you take over from here, and you let me know when you want me to advance the slides.
Sure. Good morning. And so according to the poll, so 75% you work with SLPs. So you know who is SLP, what do they do, and the role of SLPs, speech language pathologists. But briefly, I go through some information here, and then we can like debrief the poll and chat a little bit about SLPs. So SLPs and like audiologists, as Angela mentioned, they rely heavily on language data as a tool for assessment and treatment planning. And when there is interpreter involved in SLP sessions, things might be more challenging. And we need to have, as an interpreter, so when I say we, I mean interpreters, because I mainly work here as an interpreter. We need to have like hands-on tools to ease the session with SLPs. And as you know, SLPs, they assess, diagnose, and treat communication the disorders, speech disorders, or swallowing disorders. With children, mainly it is like speech or communication disorder. And so there's a variety group that SLPs work, children, adults, seniors, and the other side, like healthcare, educational professionals, and private practice. And they conduct standardized tests and therapy sessions that requires particular ways of utilizing words, language, pronunciation in the communication assessments. And working across languages, it introduces, sorry, Angela, further complications and complexities as the words, the words, the ways of speaking and using the mouth and how sounds productions, phonetics, and those things. And SLP sessions, SLPs, they depends on interpreters to understand the patient's responses, how they how the patient produce sounds, utilizes the words and phonetics. And so we need to understand that what does SLP mean by particular exercise, by particular phonetics, by particular sounds that they want the patient to produce. What is the rationale behind that? And if, as an interpreter, if we are aware of the strategies of the SLP's work, it is ensuring for us and for the SLP as well to be able to conduct a proper diagnose and subsequently effective treatment plan. Interpreters working with SLPs, they know they must work. The interpreters
need
working.
to move to the next.
Pardon.
The next one.
Pardon me?
It says effective treatment plan, and then we saw a slide for just 1 second, and it went back to this slide. Is that? Hadn't you finished?
Yeah, I think we're still here, but actually, I wanted I introduced this slide at the last minute. Sorry, Layli. So said, I think that it's interesting for both sides to kind of talk to each other. As a couple of weeks ago, I did a presentation to Speech Hearing BC, British Columbia. That's where the province we're in. And these are some of the comments that came up from the therapists. And they're saying basically they have no idea what's happening in front of them. And, and it's not because they're necessarily untrained interpreters, which also exists and happens regularly, but it's also because the interpreter needs to understand. Let me go back to this slide. where it says the interpreters need to understand the patient's responses. As an interpreter, when you understand something, you're understanding the meaning that you then need to convert, right? When an SLP needs to understand something, it's a completely different thing, right? There's a judgment call in that. And the tools that they use to make the assessments or make the judgment are what's out of your reach. You're not doing, so the way interpreters are trained to be, faithful to the message and find the equivalencies, they kind of go out the window with SLPs. Because if you've tried to find, I always say, let's say the equivalent, does everybody speak? No, there's a Portuguese speaker here as well. If the SLP needs to assess the architecture and pronunciation of a child, when they say the word cat, the very hard C, the very hard T, in Italian, I'm going to say gatto. That's not the same word. It's not the same sound. It's the exact same meaning, right? So that is where the disconnect happens. And that's why it's really a complex care setting, right? We need to be much more involved, much more aware. And some of the rules, like in mental health, I don't know if people have taken mental health training, some of the rules shift a little bit, right? So these are some of the questions that, or the comments that came from SLPs and audiologists themselves. The interpreter was hesitant, I love this one, to provide verbal models. What the heck's a verbal model? Do you know what a verbal model is? If I ask you to do a verbal model, can you do it? No, I don't know. They're hesitant to do. Of course, they are hesitant to do. They don't know what you're trying to get out of that. So verbal models are very important. The very act of speaking, the sound, the architecture of the mouth is the tool for assessment, right? So you are now part of that equation as an interpreter. And how do we do that? And sometimes, really, how much further is our work need to be enhanced, or understanding need to be enhanced in order for us to fully facilitate these sessions? So the need to build in caregiver questions, the other issue we have, of course, if families are involved in an educational setting, perhaps families aren't always involved, but if families are involved, they're also concerned and hesitant about their child's speech and all of these, so they might get involved. You're having to deal with those dynamics as well. And you can't always see if the client's limited engagement is due to accurate interpreting or if they are hesitant. As we know, right? There are different cultural rules around questioning or participating with a professional. So I just kind of threw that slide in, and then I'll let you get back to it, Layli.
Yeah. So interpreters must work with SLPs, need to accurately convey selected or analytical terminology. They need to manage cultural nuances in communication, support patient understanding without overstepping their role. So need to be very cautious about cautious about the last piece. As an interpreter, we shouldn't overstep the SLP's role. And very frequently, we need to get feedback from SLPs. And it happened for me, I usually don't reveal my speech therapy background, because it will produce an environment that the SLP rely on me, but in that particular session, it's not my role to act as an SLP. I'm an interpreter. Knowing about SLP gives me extra tools, extra experience to work with an SLP, but I don't want them to completely rely on me. So it is really good to have introductory before a session, have a discussion, maybe a brief discussion with an SLP to see what they're going to do get some idea about what's happening in the session. And as an interpreter, we need to be ready for that session. It's quite different when interpreting with SLPs. It's quite different with some other interpreting encounter in settings. So we need to know what are we going to do. We need to have like a plan of the session. You need to know what SLP is going to do during that session.
Yeah, information.
Yes. Now, Angela, are we going to
I'm
do?
here. Yeah. So we're going to do, I want to hear vocally from you besides just the poll. But what we're going to do is we have some case studies that I've put in the chat. So if you can grab it from there. So in your group 1, if you can start with the first case study, group 2, the second, and group 3, the third. If you're done those studies, you can just move on to the other case study. That way, at least all the case studies are addressed or spoken to in that way, instead of everybody starting at the top. So you'll see what room you're in when Alex assigns them, and you'll select your group. So we will do, let's do 15 minutes for the discussion, and then we'll come back, debrief that, and move into some strategies for best practices. Okay? So when you come back, get ready to talk, because I want to hear. Just
Great.
set my timer.
Well, we'll see you guys in 15 minutes.
Okay. Sorry, Richard.
So group 1, looking at the first case study, talk first about strategies. We all agreed it's always helpful if you can have a pre-session with the SLP or other professional where that's possible. Discuss any particularities to our role, what they expect of us. We talked about if there's a report that may be presented, if we can get that ahead of time so we can review it and not simply cite, translate on the spot, which takes more time and effort. We talked about, again, with the direction of the SLP, setting some ground rules at the beginning of the meeting. It may be helpful to ask the parent if there are any questions before we begin, but some of the ground rules might be not interrupting if we're in the middle of an exercise, for example, or a diagnostic tool that the professional is doing. It would include some hand signals potentially, such as, you can keep going with the information, or please pause so I can share it with the other party. Whatever hand signals you like, it's helpful. And as a post session, also, sometimes you're pressed for time. There isn't much time for questions or discussion afterwards. It's always helpful to give the parent a tool to communicate. Make sure they have an email address if they have any questions or information they want to share back to the professional after the meeting. It's always helpful to give them that opportunity. The phonetic differences, we agreed, is just a challenge. Depending on the language, some things simply don't translate, or as we saw, that sound doesn't exist in the target language. It's a challenge. Anybody else? Martha, Magda, want to add to what I said?
We also discussed on like where do we draw the line when we're asked to do things that are outside of our role, yet how do we draw the line yet be of assistance?
Yeah, so that's very interesting, Richard, and I'm sure this will I'll make some comments on here, and then we'll go back to the next, we'll go to the next case study. You guys are employees of the school system, is that correct? Your various school boards? Okay.
Or contractor.
Or
outside.
contract, okay, which is a little bit of a different setting when you are a freelancer that's coming into a setting, right? Because as you said, Richard, you know, you give the parent some information so if they want to contact the SLP. Typically, that is within the realm of the practitioner, not within the realm of the interpreter to do, right? If the practitioner doesn't offer that information, then the interpreter doesn't either. So, you know, if I overstep or don't understand your positions in terms of being employees, you know, please correct me, correct us. But that introductory the briefing statement at the beginning is so vital, right? To make sure that everybody understands it. And you know, you can even practice so that you get it down to a few seconds. At least you get it in. And if you know that most of the settings, most of the situations, I'm giving away the strategies, but that's okay. If you know that most of the situations when parents are involved or about parental interference, then make sure you get that point in. Don't get stuck on a script. Pay attention to what's in front of you and respond to that, right? And yes, you know, the hand signals are brilliant. So, you know, just kind of gestural language is a wonderful way to kind of help people understand what you need them to do. So in terms of the sounds, you know, I'm always so interested in my presentation with the Speech Hearing Association. I'm always so interested in knowing, why don't we have these tools? Why don't we already have these translated tools? And I don't mean translated like translated, I mean adapted, adopted, localized tools that where we can use it. Why are interpreters having to make up these things on the spot? It makes no sense to me, you know. So, but there really aren't that many tools. Here in Canada, an organization started a project a few years back, but it just kind of stopped, trying to create, you know, tools in other languages that paralleled what it was the English tool, the English or the French tool was doing. So, and yeah, of course, how are you supposed to on the spot figure out? And also, if you don't really necessarily know what is the intention of the session, you know, what is the goal of the session? Is it to hear the sound? Is it to see, you know, movement? What is the goal? I don't, so hard for you to modify, adapt, create in the moment. But so thank you very much. I'm just gonna, is that okay if I make comments as we go through the case studies like that? Okay. Layli, do you want to add anything?
It's perfectly like you perfectly elaborate everything about like phonetics, and as you all know and you all mentioned, SLPs, they don't look for the meaning. They don't look for if the child knows the meaning, and we're not at that specific encounter. We don't interpret the words actually. And we need to be ready for the phonetics, phonetic equivalences actually. For example, I don't know, the interpreter the SLP wants to check the word if the child is able to produce, for example, bilabial sounds. So we need to know exact equivalent in the language, in the other language, a bilabial, not a bilabial, maybe a few bilabial words, starting with bilabial sounds, to able to help. If the SLP says like cat, they don't look for, we're not going to translate the word cat. We need to have the same phonetic equivalences in the word that we're like interpreting.
Layli, how do you say cat in Farsi?
Gorbe.
Completely different.
Completely different, and it's more difficult. Like
yeah,
ge and o sound. It's really difficult.
I remember. Yeah, sorry. Go ahead.
It's fine. You go ahead.
Layli,
I was just going to say an anecdote. Yes, Richard?
No, I don't want to interrupt you.
You're not interrupting. Go ahead.
Okay, so I totally understand. We're not looking for how you say the word in another language, but for example, cat, it's easy to ask a child to give the k sound or the t sound, but for a language, let's say, that doesn't have the English TH.
Mhm.
How do you explain that?
And that's exactly what I was going to say. So my family's from Italy. We immigrated, and to get the sound, my mother's like, you can't, people think that you have cognitive challenges if you say th. So for years, she couldn't say teeth. She'd say teat, teat, mom, teeth. Or she'd say feet. No, my teeth. I mean, her English was fine, but it's just like getting that over that sound because she did not grow up. It wasn't taught. Right? So if that's what you're assessing. And the thing is that, yes, in the moment, an interpreter could modify. If you're an intelligent person and you've had long experience, you could. But SLP exams are standardized, which means that adaptation should also be standardized. Because now Richard is doing an assessment with a Spanish-speaking child and adapts it one way. And then Marta comes and does it another way, and it is no longer standardized. Right? So that's the other piece is, yeah, I can help, but I'm not an SLP. I'm a smart person and I'm bilingual, but I'm not an SLP, right?
So are we just supposed to take our cue from the SLP?
Well, we'll go through that.
Okay.
We'll go through that because I think, as I said at the beginning, what's happening is there's a massive disconnect between the two professions, and there needs to just be more connection. And I think, the presentations such as I did to the speech hearing associations, your associations there in the US, people need to. The other thing I say to professionals is this. You're a professional, you've invested in your education, you take pride in the work that you're doing. If the interpreter that you're using is either untrained, which happens, or if the interpreter doesn't understand your intention, your goals, because this happens in legal settings too, right? Where inflection and intonation is very important. The lawyers speak in a very practiced way. If the interpreter doesn't understand that, you've lost your whole, professional positioning. You're not doing your job. You're just kind of there. So I think professions need to understand this is not just about the non-English speaker or, in Canada, the non-French speaker. It's not about that. It's your own professional integrity. Interpreters are an extension of the work that you do. And that's the way we kind of need to phrase it, Anyways, I'll get off my soapbox and we'll move on to the next case study. Who was number 2?
We had the second case study, and I'm going to report out on some of our notes. So the SLP is working with a nonverbal child who has a communication device. The situation is that the parent is interrupting, explaining, and then prompting the child and not allowing for direct interaction. Because of that, we all felt that in order to help facilitate the communication, some sort of intervention was necessary. And we mostly believed that the first best step would be to speak to the SLP directly and then make that communication transparent for the parent. And the questions came up, was a pre-session done? And whether or not there was a pre-session, was there uptake of that, understanding of waiting? And of course, wanting to be respectful to the parent. Maybe they've become accustomed to try to speak for or explain for their child. And of course, have concerns about how that child might do during that communication. So that was really what we had discussed primarily.
Thank you, Leonard. So Vanessa, Monica, and Monica were in your group. Vanessa, Monica, anything else?
No, I just was telling them that sometimes in this case, Monica stopped me because I was like, the mom needs to understand that she's not helping. And then Monica put me back on my, like, that's not your role. And that is something that is hard to me. Like, understand that I always try to advocate, and then I need to put myself back in the role that that is not that is not for me to say, but it's hard.
Yeah, it is hard because, interpreting, especially community interpreting or community and public sector services, it started, well, actually, to tell you the truth, it's the oldest style of interpreting before conference interpreting knocked us off the shelf, but or simultaneous interpreting. But, in North America, Australia, it started as a helping, we help. And so kind of detaching or disentangling from that persona can be hard. But there's a scope of practice. You know, your scope of practice is about enabling communication. If the practitioner that you're working with is a horrible practitioner or a horrible person, so be it, right? If they don't give all the information, so be it. That it's not your role, and you guys know this, so this is repeating. It's not your role to appease or facilitate or accommodate either the client or the parents. So, however, it is important to understand that these are emotional and delicate situations. Parents with young children, seeing their children in what they, you know, might be potentially a crisis situation. So, you know, we understand that, right? We understand, and there's empathy. You can't be an interpreter without empathy, because you can't understand what a person is saying if you are not empathetic. But there's a boundary where you go from using that as an understanding to using that as advocating, which is not what you do. But I think it is important for an interpreter to prepare themselves for this is going to be a challenging situation, because parents are concerned about their kids. They're going to interrupt. They're going to, right? So you need to just be prepared. Yeah.
Yes,
Monica,
I want
do you
to
wanna... Oh, go ahead. So sorry.
an interruption. Like here in BC, when with school districts, there are like residing SLP for maybe between 1 to 3, 4 schools in school districts. And when this SLP is meeting, and most of the time SLP is meeting with the children at school. So that's a good point, that parents are not involved, caregivers are not involved. But there is, I want to know, like, how does it look like in your region? But sometimes it's challenging to take the school, to take the child from the classroom to the SLP's room. And when the child is in SLP's room, it's like a agitated child, very bad tempered. And think of that situation, that you're there to interpret for an agitated child, like let alone the difficulties, disorder, and things, let alone that it's an agitated child, very frustrated of changing their position or their place. And this is something that we should have in mind as well. Sometimes there is no caregiver, no parent involvement, but the child, then like itself, themselves are very hard to deal with. Like not just the, and when you want to interpret, when you want to talk, you are the main center of focus, not the SLP.
Yeah,
it is something adds to the challenge.
that's true. You become the focal point because you speak the same language. Just a show of hands, how many people work with children, let's say, on up to 6? These are public schools, so it's 0 to 6. Let's just say 0. Okay. 7 to 12, which is elementary. 7 to 12. Okay. And people working in high schools as well? Okay. Okay. So just trying to understand, because up until a certain age, it's really hard. Children might have multiple diagnoses and you don't know, right? They might have an autism, they might be on the autism spectrum, ADHD. Up until, 7 or 8, really cannot diagnose a child, right? Because everybody's at a different developmental stage. So like Laylee says, there are other factors as well, right? As you probably all know, there are other factors as well involved in that. Agitation, aggression, all of that as well. Plus, if you're not, I was a non-English speaking child. I spoke Italian. I always joke that up until university level, I was still being corrected for my English by my friends. So it's frustrating when you don't speak the language of everybody else. Some of you may know that, right? You're in class and all the other kids speak to each, and you're like, huh? So it can be very intimidating. Thank you very much, Leonard. Case study 3. Okay. Case study 3 was Emilia and
Carla,
Carla
do you
and
have
Vivian.
the, can you read what you had printed, Carla? Can you read, because you had been the one that shared the screen?
We have a case of a child, and he has struggled producing the English R and TH sound. So we discussed this case with Emilia and Vivian, and they both work with little ones, so they were kind of familiar with these kind of scenarios. And Emilia, you want to say what you were like putting on practice?
I've worked at the two sides of the spectrum. I work with the disabilities in Ohio. So a lot of times some of the speech pathologists come with 2 or 3 other people to the parents' home because the kids have other things like problems with swallowing or their tongue and things like that. So there's all kinds of layers of things. And then I've been, after the evaluation is done and the speech pathologist is having a meeting with the parents, and then they're talking about the results. So those have been the 2 spectrums, but I always want to have a pre-session with anybody that I interpret for. I want to know what the expectations are, how much time we have. And I think Viviane and I were both saying the same thing. I sit on the floor with the children. I think it's important that I position myself in that place, because I need to watch everything that's going on. And to me, that is important. And yes, it's hard sometimes that you want to advocate, but I feel like I need that helps me maintain my impartiality, but also my familiarity, if I'm making any sense.
Yep.
Am I explaining myself?
Yep.
I do the same thing. I mean, I'm new. I've done a couple diagnostics and evaluation, but I do the same thing. I usually, when I go to I've done that, I remember vividly, to the parents' house, and there was a brother in the session as well. He was also sometimes trying to help the little brother. And I sat on the floor and I was, like trying to have like 4 eyes kids and the speech pathologists, but it was tiring, but
yeah, it's exhausting, right?
Yes.
Handling all of these dynamics. I know one of our interpreters, one of our members, she was telling me about situations when she's also dealing with kids that have autism, and your tone of voice, right, can set off. So, first of all, can you be trusted? Maybe they've already gotten used to the SLP, but now you're somebody new. And children that are running around, and the SLP is like, what are they saying? What are they saying? And she's like, and then you just go into either word for word or descriptive, because that's all they want. The SLP just needs to hear what they're saying, so now you're interpreting mode. What are you using? In mental health, frequently you do go into descriptive mode about what you see, what you are experiencing. These are not the words coming out. This is what, as a bicultural, bilingual person, this is what it's experiencing. And you leave it to them to assess what is going on. But yeah, Viviane, it's dynamic, right? It's constant. And I can just see the little brother coming over and trying to help, maybe even touching you in the head. Touching your hair, right? So what do you do?
Yes.
These real situations, yeah.
And they have a lot of tools and toys and sometimes iPads and of course they're gonna put one at a time because they have a strategy. They want to try one thing at a time because they wanna see what is gonna happen with the kid. And sometimes the big brother went there and grabbed the toys, and she was like, no, don't touch it now. But I was just like trying to be mindful what was going on, but at the same time trying to get the connection with the little one, because
and that you said that they have a deliberate strategy, and it is a deliberate strategy. Sometimes when you go, let's say, home visit with a new baby in Canada, here in Canada we have new baby home visits with the health nurse. they will go and visit the mom and make sure everything's okay. That's very kind of casual, conversational, you know, it's not so much deliberate strategies with SLPs, it's a deliberate strategy. What tools am I going to use now? How? All of those things are very deliberate, right? Carla, sorry, did you want to continue on with your groups?
No, and also we were talking about expectations, talking with the speech language pathologist beforehand about what are the expectations of the session.
Yeah.
Like it's going to last 30 minutes, 20 minutes. That is important.
Yeah. Oh, that's very important. Yeah, very important. I mean, I guess that if you're
What are
employed,
the goals?
what are the goals, and also how long you're going to be, if you're, when you're freelance interpreter, the anticipated length of time or duration is not always accurate. But when you're employed, I guess hopefully that is a little bit, you're in the same place, right? So it has less bearing. Yeah. Okay, so we'll go on to some, yes.
I just wanna talk about a point. I think Viviana, it was you that you said you need, like, as an interpreter, you're going to make a like connection with the child. Yes. So what will happen to the role of SLP if the child is like communicating with me as an interpreter?
I said that because sometimes they ask and the kid, like, I wasn't interfering in the situation between the speech pathologist. I was just trying to pay attention at the answer, not trying to, oh, let me, no. I was in my spot, but paying attention, making sure that I was understanding what was going on here, because otherwise I couldn't interpret it.
You know, when as a speaking same language with the child, like as an interpreter and the child, so they tend to be connected with an interpreter more than SLP. And it is something that we need to be like aware and very like very cautious about it, because if we like get in the middle, it would be more like more responsibilities would be on us, and yeah, it will make our job more difficult. Yeah.
I'm just looking at the comments. Magda asked, what is an EDT? Vanessa, you posted that. Do you want to tell everybody what a EDT is? Is she there? Eligibility, okay. Eligibility determination.
Sorry, I had to do something else. Yeah, it's like in our school district, we do the EDT that is explaining the mom the findings and how the testing went, and if the kid is eligible or is not. So it's the meeting previous to the IEP. Like if the kid qualifies, then they do the IEP meeting. But it's basically the people that did the screening explaining to the parents their findings.
That's the other thing with
Thank you.
with being an interpreter on community levels is in public sector is all of the acronyms, right? I mean, I'm sure the US is just as in love with acronyms and abbreviations and all of these things as Canada is, but it honestly, it just gives you whiplash trying to figure out what half of these things mean sometimes. And then, you know, interpreting them. Okay, so let's go to some strategies that we can use, and then we will open it up for questions as well. You know, you need to be aware of the fact that there are potentials, right? There are pitfalls, right? So just be alert to the fact of what is happening and how easily you can make a mistake. And I don't mean a mistake in interpreting, just a mistake because you're not always necessarily informed of what the process is. So, avoiding assumptions, asking for clarification, asking for intention if you can. Speech language, well, language is culture. We are not cultural. In Canada, we do not have the cultural navigator model. Not for the most part. No. It's language, but that's fine. But language is culturally based. It's informed. Even if you look at Spanish, all of the countries that speak Spanish, they have different words for some things. In Spain, Colombia, Ecuador to Costa Rica, it's the same language, but is it? So it's infused by culture, and we need to keep that in mind. So what are some of the best practices? Understanding as well, interpreting versus assisting. Sometimes you might ask, can you simplify the instructions? Can you explain it in a way that makes sense? Can you find an equivalent? Well, no. I mean, I can try, but it's not my role, and I don't have enough of foundation to really help you that way. So finding ways of, even in the moment, educating them. Okay, even in the moment, taking it as an opportunity to teach the SLP about your role, and maybe they will take it back to their colleagues and say, we need to do better around this. Okay, so what are some of the best practices? Technical term, I don't know. I think we've talked about this. I'm not going to go into that one. One of the things that is really important is, even before the appointment ever happens, is that initial research. So inform yourself, right? Build up a glossary, build up a knowledge base. I don't know if the association that you're with has those tools for you. There are some interesting studies that have come out recently around working with interpreters and for SLPs. So there are some things, right? They might not be directly like, how do you do this in Spanish, or how do you do this in Portuguese? But it gives you more context, and that will inform your practice, down the road. So even before the session ever happens, before you're assigned. But if you are a freelancer and you're assigned a session, getting to know, we always teach our students here research skills. How do you research this? If you're given scant, if any, information besides the name, let's say the name of the doctor and the clinic, their ambulatory care, outpatient clinic, whatever. Oh my gosh. So you go on and you start researching. Who is this doctor? What do they do? What are their specialties? What are the words associated? All of those research skills really help you show up prepared. Okay, so what are some of the things that you can do? There is no replacement for the pre-session, and I think Richard said this as well, Emilia, that pre-session is important, and it doesn't have to sound or be as onerous as it sounds. It doesn't have to be a half hour, 5 minutes. What is the goal, right? What are we trying to achieve? What are the tools that you're going to be using? Is the child verbal, nonverbal, right? Who else is involved? What previous experience have you had? So what are the questions you can ask in that pre-session? And, if you facilitate the SLP's life, they like that. So you make it quick. Review any sort of key terms or vocabulary that they will be working on. And clarify as well the interpreting mode. I don't know if many of you work in simultaneous, but sometimes working in complex care can be very fluid. Like I said, mental health, you start in consecutive, you go into simultaneous, now you're finding yourself in something completely different. What am I doing? But you and the therapist have achieved an understanding of what the goal is. So that fluidity is okay, because we're working together. Does that make sense? Please do interrupt, put your hand up at any time. So what can the SLPs do for you in advance? They can provide you with key vocabulary. They can prepare you for pronunciation differences, and they can be open to adapting. That is what, is something that you need to keep in the front of your mind when you're doing that pre-session. They can do these things and it will help you. This is a quote from one of our members who's a Mandarin speaker. You know, they ask for the pronunciation sh or sh, which in some kids can't pronounce. But they give them to the words in English, but the child doesn't understand English. And if I translate the word in Chinese, it's totally different, as we've spoken, right? So some therapists are very good. They ask her, but this interpreter's been working in the field for close to 30 years and is very, very, very knowledgeable and very experienced. So she feels okay, confident as well, being able to do that. But not everybody does, right? So recognize your own limits as well, your professional limits, which is also recognizing your professional limits is also an opportunity for growth, right? That now you know that you can expand or grow on them. Leili, do you want to add anything?
I wanted to, it's, you know, when I was working, maybe not quite related, but at some point, maybe we can adopt some strategies with SLPs. I've been working in mental health setting for a long time, and there's an assessment. They call it, maybe you're familiar with it here, they call it MOCA test. And MOCA test is like for checking like brain damage for elderlies. The strategy, like the instructions, the words in that MOCA test, sometimes it was not present in the target culture or target language. For example, they were checking, there were pictures of 3 animals. One is camel, for example, one is rhino, one is, I don't remember, some, let's say lion. In Persian culture, in rhino is not something that, it's not like in that area, it's not, they don't know what is rhino. So it's difficult for them to remember what is rhino, and that's like undermines the evaluation, like the validation of the assessment. So after a lot of back and forth, we put things together and we make a Farsi test, like Farsi MOCA test with supervision of professionals in that area. So we came up with a MOCA Farsi test, and I have one with myself everywhere where I go. And then when I see they put up English MOCA test, and I said, no, use this one. And I think this is something, it's good. If you're a big group, you can do this. Like SLPs could come up with some particular words, arrange it in a like phonetic, I don't know, whatever they're trying to assess, like if if they want to assess voiceless TH sounds, there should be some words and should be available to the interpreters to find the equivalencies, not regardless of the meaning, phonetically. And it should be something that all the interpreters and SLPs have access to that. It is really like peace of mind, and it's a very good maybe tool to help mainly interpreters and SLPs themselves as well. But in mental health, it's a bigger association, stronger, like more like wealthy comparing to SLPs. I don't know if you can do that in your the community of interpreters and SLP. If you're working directly with so many SLPs, I think it's doable.
I mean, this is the thing that needs to happen, is the tools need to be done, you know, once again, because the practice is the assessments, the practice, even the treatment plans, right? It's all standardized. And so it needs to be done in the same kind of deliberate process. The project that had started here in Canada, and I keep trying to nudge them to continue, is exactly what you're saying, Leili, you know, so you're looking at the sound, and now let's take Arabic. What is the sound we're trying to get in an Arabic? Now, what is the word that we're going to use to associate that? How do we then know whether or not that is said correctly or not? Because the other thing too is even if the interpreter has, you know, the word, let's say that they find the equivalent sound, now you're also asking them if they said it correctly, right? And so that's another level of like, wow, you know, because did they say the word, you know, like a Swan here, this Mandarin interpreter that's on the quote, because of her experience and, you know, smarts and everything, she can find the equivalent, and she can also say, yes, it was said, it sounded and was articulated correctly. That's another level of ability that interpreters have. Like, that's a lot. Personally, you should get paid 5 times more than what you're getting paid. I think community interpreters should get paid more all the time. What happened to my, oh, there it is. Yeah, I mean, it's just not an easy job. It's amazing, and I know everybody loves it, but it can be challenging. Okay, what can you do during the session? You know, you always maintain your professional ethics and your professional role, right? And beyond that, you know, you always are transparency is very important, right, in interpreting, as you know, right? Be transparent about whatever, be transparent to all parties. If you know, if you're start off in consecutive mode, but now need to go into another mode, you know, the interpreter like to interrupt. They just want to say, this is different. I'm going to start doing this, you know, and make sure everybody in the session knows that. Keep pace and the tone that's appropriate for that the SLP needs. So like mental health, you know, you kind of have to follow the vibe of the therapist, right? I remember one speaker that we had in our mental health training, and he was a psychiatric nurse. This is a long time ago, and he was saying to the interpreters, people like, oh, I'm going to be so afraid, you know, people with mental health issues, and he said, you don't have to be afraid. This is institutional and non-institutional mental health. He said, but if I'm standing close to the door during the session, I would suggest you come stand near me as well, right? So it's like, follow what the therapist or what the attending practitioner is doing. Emulate that tone that they're doing, even in non-verbally. Ask for clarification and relay all of the attending family members' informations and questions to the SLP. That back and forth as well. If voices are overlapping, if somebody's interrupting, the interpreter would like to interrupt. I cannot do my job if you talk while somebody else is talking. You can say to the SLP, can you please assist me in managing this session so that we can get through the process properly, right? You guys all do intervention techniques. You know that? Yeah. After the session, it's always good briefly check in with the SLP. How do you feel? Do you feel it went okay? Could I have done something differently? You know, those provide feedback on any challenges. You know, with all due respect, I think it was challenging for me to have that content or be asked that thing, or, you know, too many family members or the noise or whatever it was. Give them some feedback. Clarify if you feel that there's anything that's a little bit niggly, you know, you got an inkling, you got to say something. And then, you know, this is good practice for anything, right? Immediately after leaving, finishing the set, sit down, write yourself some notes on a pad or on your computer. How did it go? How do I feel? How does my body feel? What could I have done better? Where are some areas for improvement? That's just good practice, right? That's how you improve as a professional. And I think really the main thing, and I don't know, Alex, if you're the guy to say this to, I think really the main thing is trying to create collaborative projects with SLPs, you know, and maybe for those of you that work in schools as staff, maybe you can say, can we at least start this discussion? Because it's very, very challenging. Regardless, the only thing that an interpreter can really do is that open communication from beginning to end. That's what you can do. And the other thing you can do is keep your skills current, right? Keep your skills current, keep yourself in check, make sure you're within the scope of your practice, you're not outstepping. But other than that, you know, that's a whole other profession that how can we adapt their techniques, right? You know, and it's so interesting because the session I did with the speech language therapists, they're like, the interpreter does this and the interpreter is bad. And I'm like, what responsibility did you take on for yourself to make sure, first of all, was it an actual interpreter? Are you trained? I always tell people, ask, were you trained? Where are you trained? And secondly, did you guide them? Did you manage the session, right? So everybody in an interpreter assisted session has a role to play. And that all needs to be clear. Okay, so that's many thanks and gratitude to our members at the Interpreter Lab. We have a wonderful group of members at the lab. We invite you to check us out, and interpreters everywhere. That's it for our presentation, and I just want to see if there's any questions at this time.
I do have a question.
Yes, Martha?
So, and this may have been, you know, already explained and maybe I missed it. But I would like to have more clarity on where to draw the line. I mean, I'm thinking liability, especially
I'm sorry, I can't hear you very clearly, Martha. I don't know.
Okay, can you hear me
Oh,
better
that's
now?
perfect.
Okay. Yeah, I'm trying to think liability. Where do we draw the line? We want to be, you know, assistants, we want to be helpful, but especially in the special education realm, we want to be very cautious. So when we're asked about articulations, was this properly articulated? Was it well pronounced? How do we handle those things even if we may have a background in education, but we're not necessarily licensed speech and language pathologists? So by us responding, we're somewhat assessing. So do we or we don't?
Yeah, exactly. You're not somewhat assessing. You're like, now you're a filter, right? Through which this is understood. So you are assessing. That's what I'm saying. Even if you find, you know, how to say that sh sound in Spanish, now you have to tell me if they said it properly. Did they say sh? Did they sh? Was it hard? Was it soft? Was there a tongue involved? Because that's the placement of the tongue in the mouth also changes the, you know, that's what they're assessing, right? And now you have to tell me. So in terms of liability, I don't know if anybody else is, what we say in Canada is this: if you are employed or represent an agency through which you're a freelancer, the due diligence is on the agency to make sure that you have the competencies to do your job. If you're a freelancer walking in, then errors are on you for liability. Now, that's just an insurance thing. If you're talking more about kind of ethical liability, how do you feel, you know, that's a different issue. And I, you know, I always say it's one of my favorite quotes of me, that I always say, the difference with a professional is that a professional understands the weight of their responsibility. They understand the impact of that errors make. And so that's all I can say is you can say to the SLP, I will, with my limited experience, I'm not an SLP. As a bilingual person, as a bicultural, can give you that assessment, but I'm cautioning you that that's what it is, right? It's a layperson's kind of layperson in terms of SLP, right? Assessment. And just be very cautious when you're speaking to people about what that means.
I just
Does anybody? Oh, yes, Lily.
just interrupting, Marta, when the point is that like the SLP can hear the sound production. So it's not on me as an interpreter to say, okay, was it soft? Was it hard voice? They can hear it. The point is that getting to that production, that's the matter. That's the matter that like the SLP, and it's up to them. They should have like cat, when they're saying cat in English, they should have the same phonetically in other language for the interpreter.
Yeah, well, that's what we're trying to get to, right? Is that that collaboration before, so that we land in the session with the tools.
And for example, C, like before A sounds this, they're different like place, like in vocal, like oral production, vocal cavity, there is different place. So, and even if I come up with something similar, it might not be the exact production in that in English.
Yeah.
So they should have, actually they should provide with the equivalences in the target language.
The SLPs, not the interpreters, right?
Yes, yes.
But the reality is that you're not going to find that, right? So that's yeah. But I wanted to hear from others. Sorry, Lily, go ahead.
No problem. So as an interpreter, we're not SLPs. And I told you, I never revealed that I have the SLP education. Because they will rely on me, responsibilities on me. So no, I'm all like ear and eyes into what SLP is doing, but I don't say anything because it's not my role.
Then they're going to let you do it. Yes, Amelia?
Thank you.
What other kind of workshops do you offer?
What kind of workshops do we offer? So we have a monthly session for our members. We just did one on Thursday with, it's called Voice Articulation. Interestingly enough, it was with an SLP, but she talked about confidence, protecting your voice, projecting confidence, articulation, intonation. It was a very interesting talk. So every month we have a different presentation. And then at the Interpreters Lab, we also have courses, but you guys have courses as well, right? You all have training through the US-based, some of the US-based trainings, correct?
Yes, yes.
But I invite you to come and join us. We had a very interesting session a little while ago, about transferable skills. So we had some employment experts come and help interpreters identify some of the soft skills. Like you all think, you're language experts and that. There's so many skills that an interpreter have. And soft skills are critically important, especially these days. Being able to extract and package that so you can transfer your apply your work and your expertise in other areas as well, but kind of expand your practice. Anyways, that was one interesting one too.
Well, thank you very much, Angela and Layla.
Thank you,
we
Alex.
truly
Thank you
appreciate you
all.
presenting for us.